Hey everyone, welcome to season 3. This is Shauna.
And this is Rosalina, and we're your hosts for Too Young for This Shit podcast. This podcast is not just about boobs, but our journey with cancer. We are young millennials, open about giving you our raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer. Hi everyone, I'm your host Rosalina, and welcome back to our third Tit Talk. If you haven't tuned in before, this is our mini-series where we dive into all things breast cancer news, bringing you the latest updates and vital information to keep you in the know. I will link all the resources mentioned in the show notes. Today, we're going to talk about a new study published in JAMA Oncology with some interesting findings regarding vaginal estrogen therapy and if it increases the risk of breast cancer-related deaths. First, a quick recap. In this season, we had a dedicated episode on sexual health where we spoke to medical oncologist and sexual health expert Dr. Laila Agrawal on a misconception about hormone-positive breast cancer and the use of vaginal estrogen. Dr. Agrawal shed lights on this topic, emphasizing that women with this type of cancer can indeed benefit from vaginal estrogen creams or tablets if non-hormonal treatments did not work. It's an episode worth catching up on, especially since discussions about women's sexual health are often overlooked. Now let's get back to the JAMA Oncology study published on November 2nd of this year. Researchers surveyed and analyzed the data of nearly 50,000 women in the UK. The objective of the study is to examine the potential association between vaginal estrogen therapy and breast cancer-related mortality. From their analysis, they found no evidence to show that vaginal estrogen therapy increased the risk of breast cancer-related mortality. But to dive deeper, we'll examine who were in the survey of this group. So according to the study, exactly 49,237 women were surveyed in two large cohorts split between Scotland and Wales. The women in both cohorts were aged 40 to 79 and had been newly diagnosed with breast cancer. Out of this group, 5% of these women used vaginal estrogen therapy after being diagnosed with breast cancer. That's about 2,461 women. Compared with those who did not use hormone therapy, there was no evidence to suggest that this group had a higher risk of breast cancer-related mortality. So, how could the researchers measure the mortality rates of women being surveyed? The researchers analyzed data compiled from records to make these conclusions. First, the researchers chose the cohorts from National Cancer Registry records. The women from Scotland were chosen from records dated from 2010 to 2017 and from Wales from 2000 to 2016. Then researchers looked at how many women used vaginal estrogen therapy, which includes both tablets and creams, by pulling data from pharmacy dispensing records and general practice prescription records. Finally, they looked at the national mortality records and found that from among this group, 5,795 women had breast cancer-related deaths. Researchers then plugged this data into a commonly used medical research model. They found that from this data set, there was no evidence to suggest that women who used vaginal estrogen therapy experienced an increased risk of breast cancer-related mortality. The data analysis to reach this conclusion took place over the course of a year from August 2022 to August 2023. So, what do these results actually mean? First, it's important to note that the study does not state that for every single person in every single instance, vaginal estrogen therapy poses no extra risk of increased mortality rates. The conclusions state that within the data group of this study, they did not find any evidence that vaginal estrogen therapy contributes to a higher rate of cancer-related deaths. We wanted to note that to remind everyone that it's always important to analyze studies critically. With that being said, these results are encouraging and suggest that vaginal estrogen therapy can be a low-risk option for many people. But as always, we recommend talking to your doctor to determine the best course of treatment for you. Dr. Agrawal also posted about this study on her Instagram account, which we'll link in the show notes, and noted that the study did not look at recurrence but only breast cancer-related deaths. There was another recently published study that looked at recurrence risk associated with the use of vaginal estrogen therapy. From the data surveyed from about 42,000 women, researchers found no increased risk of recurrence within 5 years. We'll also link this study along with Dr. Agrawal's analysis in the show notes. So, what is the professional consensus around using vaginal estrogen therapy? In the 2018 edition of the Journal of Clinical Oncology, the American Society of Clinical Oncology recommended the use of low-dose vaginal estrogen as a treatment method for some patients. In 2022, the North American Menopause Society also recommended low-dose vaginal estrogen therapy as a method of treating vaginal dryness. And lastly, Dr. Agrawal, along with many other doctors, uses vaginal estrogen therapy when addressing sexual health concerns in patients. And of course, you should always talk to your doctor to get the best treatment for you based on your health history. So, to end this, what are my thoughts? And I believe that this study marks progress in exploring additional approaches to alleviate side effects for women undergoing menopause due to breast cancer medications. But I'm looking forward to more studies that check both the risk of cancer coming back and the chances of survival. Many women, like myself, worry about cancer coming back, and that fear might keep them from trying this therapy, especially those with higher chances of it returning. So, more research here could give us a clearer picture of how vaginal estrogen therapy impacts both of these concerns, which helps women make more informed choices for their health. That's all the news that we have to share this week. We'll be back in the new year with our fourth and final Tit Talk of season 3, and I hope everyone had a safe and healthy holiday.
A very special thanks to our podcast producer, Bethany Allard, and our podcast editor, Ayla Anderson.
Thank you all for listening and supporting our podcast. Sharing our stories with you has been incredibly healing for both of us, and we hope it helps other women in their journeys through breast cancer.
Ladies, if you enjoyed this episode, please share it with your friends and fellow breasties. Help us reach more women by subscribing and rating us on Apple Podcasts, Spotify, and now on YouTube. You can follow us on Instagram at TYFTS Podcast and email us at tftspodcast@gmail.com. We love hearing from you guys, so shoot us a message. We will link any resources from the episode in our show notes.